First, I would like to thank our very illustrious guest speakers, and good evening to you both. Welcome to this seminar being jointly sponsored by the Institute for Global Health, the McCormick School of Engineering, the Buffett Institute, the Department of Preventive Medicine, and the Lurie Cancer Center. Thank you very much. My name is Dr. Rob Murphy. I'm the Executive Director of the Institute for Global Health and Director of the Center for Communicable Diseases here within the Feinberg School of Medicine at Northwestern. I'm also the John Phair Professor of Infectious Diseases and a Professor in Biomedical Engineering. Thank you so much for taking the time to join us this morning for a dialogue with frontline clinical and public health experts on COVID-19, coming to us live from China. This webinar, as I mentioned, is co-sponsored by all the institutes I just mentioned. And today we are thrilled to have with us Dr. Fan Wu and Dr. Xin Zheng. I'll mention a little bit about their backgrounds first, and then we'll start with Dr. Wu. Dr. Wu is the Deputy Dean of the Shanghai Medical College, Fudan University. She also serves as an expert of Shanghai Municipal Leading Group for Control and Prevention of COVID-19, member of the Committee of Shanghai Science and Technology Research Group, and a member of China WHO Joint Commission on COVID-19. She has successfully served as the Deputy Director of the Division of Disease Control and Prevention, Shanghai Municipal Health Bureau, and is the founding director of National Center for Non-Communicable Disease Control and Prevention, China CDC. In addition, Dr. Wu is the Director General of the Shanghai Municipal Center for Disease Control and Prevention, the Deputy Director General of Shanghai Municipal Health Commission, and Vice Mayor of Yiji City, Guizhou Province. At this time, I'm going to have Dr. Wu give her presentation, a dialogue with frontline clinical and public health experts on COVID-19. And after her presentation, I will introduce Dr. Zheng. Thank you. Dr. Wu, thank you again very much for joining us tonight.
Okay. Thank you, Dr. Murphy, for your introduction. It's good evening, everyone, and good morning, everyone, and good evening for my Chinese colleagues. It's really my pleasure to share the information, how we do that, we take the response to COVID-19 in China. So my presentation will mainly focus on the epidemic knowledge and also China's response to COVID-19, either for the whole country and also in Shanghai. Let me give you the full screen. Okay, so if you cannot hear me or anything problem with the slides, please remind me. Okay, so the data, this is the picture of China, whole picture of all the reported cases in China today. So we over 84,000 as total reported cases as pneumonia, and we also have 4,600 more than 4,600 deaths for the whole country. And the data today, currently we still have 634 cases on treatment and nearly 1,000 asymptomatic cases reported, and they remain in the medical observation. And the Wuhan, as the epidemic center in China, the city was reopened in 8th April. So everybody knows the epidemic that started that we found in last December, and we quickly the country have mobilized the whole country to take the response. So now I will show you this picture, show you what kind of the action that we taken over the times. So we stratified the epidemic, the early stage of the epidemic, as 3 stages. First stage is before January 20. That means we found that we received the reported cases, and we try to diagnose what it is, try to define the virus and do the sequence of the virus. And then the National Center of CDC reported the sequence to the rate of, yeah.
Hi, excuse me, Dr. Wu. I think we're not seeing the slides at this moment. So maybe can you double check the share screen?
You cannot see the slides?
No,
we don't see the
just the share
slides.
screen. Sorry.
Okay, so let me stop a little bit here. Let me check the screen. Okay.
Yeah.
Okay. 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 Did you see the slides?
Yeah, that's great.
Yes, that's fine. Thank you.
So you see that one?
Oh,
yeah.
perfect.
Okay. So just the two. So this is what I'm talking about, that we have the reported cases and the death cases. And currently we have the treatment of the cases remind and the Wuhan. So now I'm talking about this. So you can see this slide right now?
Yes. Yeah.
Okay, good. So I will continue to talking about it. So we stratified the early stage of the epidemic, and the first stage that you see we have a lot of actions that were taken in the first stage, and to the 20th of January that the national announced the COVID-19 pneumonia, we taken it as a notifiable diseases according to the infectious disease law and health and quarantine law. So I think this is very important. Once the disease is taken into the infection disease law, that means we need to report officially, and also we can take a lot of different kind of intervention measures according to the epidemic situation. So the second stage that we identify, once we taken the response as the national response to the resumption of labor and the rehabilitation, it's to the early 8th of February. That's the second stage. It means that is the main stage that we taken all the responses to anti the COVID-19. And then later on, it is you will see the curve. It gradually, quickly shot up, and we controlled all the epidemic until to the middle of March. So the national state stated that success on China epidemic control. So I do like this picture, because this picture shows us very clearly about what kind of action that were taken by after day. So what kind of Chinese response that were taken in this country? First, I would like to say once we got the reported and we announced the national emergency, the high-level leadership group was established. We have 9. The leadership is leading by the mayor and vice, the top one, the most top level of the national, and also 9 working groups were set up. And all these groups are leading by one minister. So it is the ministerial level leader. And if you can read this working group, including different kind of coordination group, epidemic prevention and control group, medical treatment group, research group, and public community group, foreign affairs group. So all these are leading by one minister. And it is multi-sectoral cooperation groups. And again, the laws and the regulations are developed to the emergency response to public health and the prevention and control of the infectious disease. These laws has been developed and updated. So this is the high level, the infrastructure of the leadership. So these kind of leadership, not only at the national level, but in the meantime, each province set up these kind of leadership infrastructure. To by the 29th of January, every provinces have these kind of infrastructure for leading the leadership infrastructure to the COVID-19. So I think this is very important, because all this leadership means that we have a very uniformed command system, and also can have the multi-sectoral cooperation with different kind of government departments. So Chinese response, if we taking these kind of different kind of level at. One is the unified and effective command system is quickly established, as I show you. And the second is law-based, science-driven and targeted control strategy. I will talking later. And the third is we call 4 early measures: early detection, early reporting, early isolation, and early treatments. I think this is very important for us to control especially in the out of Wuhan city. It's very important to control the epidemic. And the third is coordinated development of medical resources. Or, as you know, we sent more than 40,000 medical staffs to support Wuhan. And the fifth is the mobilization of the general population. And again, we also have a lot of international collaboration with either the country level and also with the international organizations like WHO. So the main three stage that we have. First, we have different kind of focusing. As the first stage, we focused on preventing the exportation of the cases from Wuhan. As you know, we closed the city, Wuhan city, in the 23rd of January. At that moment, it's just the beginning of the Chinese New Year. At that moment, a lot of population would like to move out from Wuhan to all of the country, to other places. And this is very important for us to preventing the exportation of the cases from Wuhan. But unfortunately, to the 23rd January, there is already have 5 million population moved from Wuhan to to the other places of the country. For the second stage, we mainly focus. We have stratified 2 different kind of epidemic model. One is Wuhan. In Wuhan, we do active treatment of the patient, reducing death and preventing exportation. But in the other province, we mainly preventing all the cases or early finding all the cases that from Wuhan imported in that province. So the second stage, we have different kind of measures in different area. In Wuhan is different, and out of Wuhan, like in Shanghai, we like Beijing, we extended Chinese New Year holidays for more taking the length of the Chinese holidays, and also do strict traffic control with mass gathering, canceled all the mass gathering activities, and all about epidemic and control measures on virus media. We do communication with all the publics, let them know why we're taking these measures. I think this is very important because everybody, they do the contribution by themselves. They stay at home, they keeping social distancing, and they know why we need to do this, why the government asked us to do this. So, and also a new hospitals we actually built in Wuhan, and in the other cities, we also have a lot of beds in the general hospitals. We taking all these beds for treatment of the COVID-19 pneumonia patients. The third stage, we mainly focus on reducing clusters of cases, especially in the area that have the imported cases from Wuhan, and also keeping early detection, finding the case earlier, and do the treatment earlier, and do the contact tracing, and quarantine the close contact person as major measures for this stage. So you will see the measures during the third stage of business resumed in face and benches. And this stage we found the Chinese New Year. The Chinese New Year is finished, and mainly the mobile population moved again, especially from the rural area to big cities like Beijing, capital city Beijing, Shanghai, and Guangzhou, to the gathering in the developed area, these areas. So we do have a pressure because the mobilization of the population is also high risk. We bring the risk of imported cases. But anyway, we do this taking the measures in very strict way, and later I will talking about this. Not only we look at different stage of the epidemic, but as a China, as a China is so big country, that we different area, actually we experiencing different epidemic model. So in Wuhan city is the epicenter, and out of Wuhan, but in Hubei province, in that province is another epidemic model, but for the other provinces, even like big city like Beijing, Shanghai, and the other rural area in the northwest or southwest, also they experiencing different epidemic model. So we stratified these areas according to their risk level as lower risk area, medium risk area, or high risk area. We tailored different kind of control measures. Even we have like social distancing. This is quite a principal measures, but once we do lower risk area, medium or high risk area, it will different. And also need to, according to the local culture, or the social epidemic status, they have different detailed way to implementing this. So this is the, I think, timely adjusted of risk levels in provinces and the regions. And all the measures that we taken in China is mainly I listed here. So monitoring and reporting the cases, timely case finding and testing, epidemiological investigation. Almost we do this very, very full coverage. And we try to find out 100% to find out the close contact management. This is quite, someone told to me, it's impossible that we do in the other country. I say no, if in the very, very beginning of the epidemic, it's possible to do that because you only have very few cases that are diagnosed. And you can do contact tracing to find out where the original the infection comes from. And also you can do close contacts, find out, this person, and do the quarantine for these close contact person, do the management. So that is essentially important to stop the further transmission to the general population. And later we will stop community transmission of COVID-19. So, and the meantime, of course, do the case management and treatment is possible because you lower the fatality. Social distancing, we can do different way, as I mentioned, according to different area. People have different cultures. They have a different model of social contacts. So social distancing will be thousands, hundreds way to identify. But it's totally depending on the local situation of the epidemic and also the culture and the social and developing level. Social mobilization, or we can call the community engagement, is very important. As I mentioned, every citizen could be the contributor in this anti-epidemic, because everyone can do the things that they can do. Not only they do the work or they do the job, but even they stay at home for 2 weeks. It's also a very important contribution to anti-COVID-19. Emergency material support, it is also important. Once people stay at home, if nobody for their support their life, it's also impossible. So in China, we do emergency material, not only the material to support the medical staff to do the treatment, but also we do material support for daily life. So I think this can keep the society as can follow all the control measures. Comprehensive researches this time we do very quickly sequence the gene sequencing and also do the other researches to find out the characteristics of the virus itself, but also to know the trends of the epidemic in different areas. Once again, I forgot one thing, the material support, emergency material support, and also in the support of health insurance. So why in China that we can do early testing for everyone, because it's testing for free. And also the health insurance will cover all these costs for the treatment. Even that a small part of self-pocket, that cost, if anybody can have the difficulty to pay for that, the government will give them support. That means if no one will not go for treatment because of the cost, cannot pay for the money. So that will be also the very important key issue, I think, this time in China, that we can quickly control the epidemic. Public health communication, as I mentioned, let people know why we need to do this, what kind of stage of that epidemic that we are, and what kind of measures that we need to take from the government side and also the individual side, the citizen side. What do we want you to do this? So for face mask and also washing hands, all these key information, health information and skills will quickly delivered to every individual in the country. So psychology care is mainly that we support for the health staffs and also the patients and the relatives in Wuhan, in the epicenter. This is mainly the measures that we taken in China. So the response, if we're talking about the response that in Shanghai, in the city where I live, it's quite similar. The only thing that different is we have a different characteristics of the society itself. Shanghai is a big city that normally we say we have 25 million population, 25 million population as a big city. And also we have 5 million as a mobile population. So normally we say we have nearly 30 million population living in this city. For such kind of large city, how we can do this? That we do full coverage, that we do registration, all the registration form for all people entering into Shanghai at that period. And we also have the medical observation for everyone from key regions. We say the pandemic regions, the people from pandemic regions. And also the service, we give service and support for all, for the related people, as I mentioned, either the medical support or financial support or life support to these people who need to do the quarantine or the others. And all measures for all, that measuring body temperature for all people entering into Shanghai, and quarantine for all from the pandemic area, and also we do health declaration for all from outside Shanghai. One thing, these people, and you will see all these measures that we taken at the whole period is mainly that as Shanghai, the cases is mainly the imported cases that we found in Shanghai city. And we also gathering, one thing is also important that we gathering patients, we're gathering all the medical experts and all resources put into the designated hospital. These hospitals normally we have, regularly we have near 300 beds, but later we also had doubled beds that as emergency that we mechanism taken, that we have another 300 beds that we have right now. So that is only one designated hospital. We also have a lot of the other, but at this time we haven't used the other beds in the other general hospitals. And we also try to generate all these resources to reduce the fatality and the strict close contact tracing for all these people. So response in Shanghai that we see, we have to timely case finding is very important. And this is very important, I think. In Shanghai, we also do case tracing and close contact management. This is the number. I wouldn't read this. You will see it. It's also a large number of this, and the slow down the city, canceling the mass gathering, and also a lot of government events and the social events. And also we're measuring body temperature for all people that do entering to Shanghai. Community engagement, we help all these people do the household quarantine, self-quarantine at home, and also the people entering to Shanghai, they also received quarantine in hotel. And individual empowering, that we do health education to everyone to concern the city, and evidence-based policy making. The government to receive, for myself, I take part in all the process from very, very beginning. The first case founded in Shanghai, reported in Shanghai, I take part in the old process and or help the government to make the policy. So this gives a lot of counseling to the government. This is the main curve, domestic cases reported in Shanghai. So as a result, you will see we only found 339 domestic cases in Shanghai as a total, and 97 died, and all the others are cured. So we've got 98% cases are cured. And most cases were mild and moderate, and severe critical cases are less than 10%. So low cases fatality ratio is about 2%. Medical staff, we've got no one infected. 211 from the other province and 128 local cases. That the local cases means it is the Shanghai city. All these local cases are found that at the situation they are be quarantined as a close contact person. So that means all these local cases, when we found them, they already be quarantined. They cannot do give the further transmission to the community. So that is why someone asked me, how can you do that? Only have 339 cases that found in Shanghai. Yes, that is the main issue that we do. So this is the and we have a relative. And we also do the testing for the general population, and we have a relatively lower positive rates among the suspected cases. So it's less than 12%. That means that the suspected cases, when we identified, it is pretty strict. And we identify a lot of suspected cases, but when we do the positive rate is pretty lower. And a hotel and household quarantine and a health observation for the domestic and imported people, we've got 389,000. Imported cases now, it's mainly imported cases. So today only we reported one imported cases for the whole country. And totally we have 316 out of nearly 8,000 testing. And we found asymptomatic case. So this is the mainly that we do as a result that we do the control of the COVID-19 outbreak in Shanghai. Okay, last two slides. One is the very important issue is now we are in the post, as I identify as post pandemic period. So what kind of measures that we need to take? I think face masks for certain population, like elderly people, like the people who enter into the higher risk places, like the hospitals, or people who want to take in the underground. We are encouraging people to take the face mask. I think until now, right now, no one will argue with the mask, whether useful or not. But at the beginning, it's true. People really argue with that. Why we need to take a mask? Because I'm not a sickie. I'm not a sick person. I'm not ill. but that we know, before this COVID-19, the virus itself, the infected people, before they onset the disease, 2 days, before onset disease 2 days, they can leave the virus same quantity as the patient. So this is, take the mask is very important for to protect the general population. Early diagnosis and do the fully high quality contact tracing is critical important to stop the community transmission. So as I mentioned before, and the testing at this time, what kind of testing that we need to do? I think it's quite an important issue, because I think that the strategy for testing should be different in the area already have a large epidemic or already experiencing a pandemic, or the other area if they don't have a large quantity of the cases that are reported and don't have a lot of community transmission already be there. How we testing for what kind of person we need to encourage them to testing, I think will be cost effective. So I think this is the really need to discussion for further discussion what kind of strategy that we have for cost effective measures, and as we also can quickly find out the high risk people and the diagnosed cases. So I think I leave this question for all of you to discuss. And the social distancing you see this time, it's truly important. And I think we still need to continue to do the social distancing. Once as the city reopen right now, I'll let you know one information. Today, the newspaper, the TV reports that almost the market is recovered as usual, 90% recovered as the usual. So that means the city gradually wake up and we reopen it, and social distancing is still very important to stop the transmission in the general population. For Shanghai right now, we are mainly imported cases from the other country, so we do port quarantine. But even if the other country we start to open and we don't have a lot of imported cases, the other two ways, the measures are still important. From my opinion, self-protection of the general population. For everyone know what, where, when we need to take what kind of measures to protect myself and a family member. I think this is critical important for long-time prevention to COVID-19. And a more sensitive case finding, especially the hospitals and the community health care center, to quickly find out, to catch the case, find them, and do high-quality close contact tracing, do a quarantine for the close contact person. I think still always the important of the high importance for control the epidemic. So prepare for future. We started for prepare for future, how we prepare for this autumn and winter. We hope that the vaccine can come out, can develop, but if not, the measures that are listed in the bar, this monitoring the virus mutation and the keep high monitoring, keeping an eye on the trends of the epidemic trends, it is very important. And the early diagnosis, again, early diagnosis and close contact tracing is important. Evaluating the effectiveness of done therapy intervention measures. What kind of measures that we taking right now? It is effective, and what kind of measures have a lower cost that we can take in this for a long time. So vaccine is important, and the new testing methods. I heard that in the United States, you developed the new testing and even found out a symptom patient, a symptom infection in very early stage before they have the capacity of transmission. That's great. So new testing methods still need to develop for further, and effective medicines also need to develop to lower down the fatality of the older patients. So that's all what I want to share with you. Thank you for your listening.
Well, thank you very much, Dr. Wu. That was an incredible presentation. We all learned so much from you. Thank you very much. Okay, at this time, I'd like to introduce our second speaker, Dr. Xin Zheng. She is a former Chicago resident, it turns out. She did a postdoc at Lurie Children's Memorial Research Center here at Northwestern years ago, and she's now a professor and director of the Department of Infectious Diseases at Union Hospital, Tongji Medical College, Huazhong University of Science and Technology in Wuhan, China. And she's also the head of the COVID-19 expert team in her hospital and supervises the isolation wards of COVID-19 patients. So, Dr. Zheng, welcome back to Chicago.
Hi, thanks for Dr. Wolf's very nice introduction for me. And let me share my slides. Okay. Let's see. Where's my, hold on. Okay, can you see my slides? Okay.
We just see the question. Oh, here come your slide.
Okay.
Yeah. Okay.
Okay. Go to the second. Okay. Okay. It's really my great honor to be invited by 6 units at Northwestern to give this talk. I have been in Chicago, I think, almost 11 years, and I work at the Children's Memorial Hospital, Northwestern, almost 9 years. So I really be happy to have this chance to share my experience here. So when Professor Huang asked me, do you have time to do that? I said, of course. You know, I have really great memory for Chicago and Northwestern. And since I started to work with COVID-19 in the early beginning of this year, I know how hard it is for medical staff to deal with this disease and how hard it is for patients. So today, I would like to share the clinical features and predictors of outcome. Since Kristen collected a lot of questions for me, so I cut off some of my slides and I try to answer some questions from your side. So, okay, sorry. So every day when I saw this increased number, I always think about that, what we can do, what can we solve this problem, what can we help the people, and how can we fight with this disease? So I think actually for getting to know this virus, it takes the time. I think it's very tricky virus. In the beginning, we think, okay, this virus, the only affect adults. Later on, we realize that the children are also susceptible to this virus. And right now, we know that it can transmit it from person to person. And for the transmission pathway, I think majorly through the airborne and the close contact. And right now, we know that the older persons who is over 65 years old with the underlying disease, such as cardiovascular disease, diabetes, and hypertension, are high-risk group. We need to protect these populations. And based on our experience in Wuhan, we estimated about 80% patients are mild cases, 20% are severe cases, and 5% of severe cases are critically ill patients. Well, in the beginning, we called this disease NCP, which means new coronavirus pneumonia, because we think the patients only presented pneumonia. But later on, we realized that this virus is so smart. It just attacked everywhere of our body, from the brain, the eye, the nose, the lung, liver, kidney, intestine, heart, and blood vessel. So for the symptoms, for me, I think most patients they start with the fatigue, muscle pain, chills, and sore throat. Here, I have to mention that actually most patients, they don't have fever. So actually, this is very dangerous. It doesn't like the flu or SARS. Okay, the patients have high fever, and then they have to stay at home, and they will not go out to work. But for patients infected with this virus, especially in the first week, they think, I'm okay, I can go to work. So they are the infection resource. And we saw that most patients admitted to hospital, they have fever, or the patients go to the fever clinic, they have fever. And some patients have cough, but just dry cough. And most of the patients, severe patients, they have shortness of breath. When they have difficulty breathing, they have to come to hospital. Well, for diarrhea, we saw some patients in the early of January. The patients have diarrhea and fever. It's very easy to misdiagnose. And later we realized that it is COVID-19. And for the nose of taste or smell, in Wuhan, for me, I didn't see any patients have these symptoms, but I know that in Germany, some patients loss of taste or smell, or some patients lost memory. So this, I would like to say this virus is really, really smart. Okay, for the laboratory results in severe COVID-19 patients, for each new patient I saw, I always check how is the patient's immune status, how is the inflammation status, how is the organ function. So for the immune status, I just used a very simple laboratory test. First is the whole blood count. For severe patients, the white blood cell is normal or just slightly decreased. It's different from the other acute virus infection. For some virus infection, the white blood cells could be decreased a lot. And for COVID-19, the neutrophil is increased. And the very important change is the lymphopenia. Almost all severe patients we saw lymphopenia, but monocyte is normal and the platelet is, most time is normal. And then we know that the patient has lymphopenia. We would like to know what kind of lymphocytes get decreased. And we analyzed some data. We found that actually the NK cells and the B cells number are almost normal, but CD3 decreased. And among the T cells, we found that CD8 T cells significantly decreased. And for the inflammation, and we checked the inflammatory markers like the CRP and SAA. We found that most patients have the high level of CRP and SAA. But for procalcitonin, when the patients admit to hospital, normally PCT is normal, but if patients with co-infection, they will be increased. For cytokine profile, we saw the high level of IL-6 and IL-10, but not for the IL-2, IL-4, and TNF. Here I have to mention that even though the IL-6 and IL-10 increase, but the increased level doesn't as high as the sepsis, because for some sepsis we can see very high level of IL-6 and IL-10. And for the organ function, we will check the coagulation system. We found that the dimer and FTP increased, but PT and AKT just slightly changed. For the liver, we saw slightly elevated LTST and GGT, but almost for all severe patients, we saw decreased albumin. And for the renal function, at the multi-organ failure phase, we saw the increased creatinine. And for the heart function, most time we saw the troponin 1 and ST increased, at the mild organ failure phase. For the LDH and the ferritin, yeah, we saw some moderately increase, but not too much. Okay, another very important examination is the chest CT image. Here, I just show you, okay, this patient 1, he's 34 years old, and patient 2 is 71 years old. And both of them took the picture on day 10. For patient 1, you can see this is a very beautiful ground glass opacity. And this is the first patient I saw. I was so impressed with this chest CT image. At that time, I guess this patient had a virus infection, but I don't know what kind of virus. And for this one, you can see the lung just white. And my colleagues from the Department of Radiology, and they use the CT score to evaluate the deletion of the lung. And you can see that most patients reach the highest CT score around day 10. And if they divide it into the different stage, and also stage 3, 9 to 13 days, has the highest CT score. And for some patients, the lung lesion can progress rapidly. For example, this one, and this picture also adapted from the work of my colleagues from the Department of Radiology. So this is day 5. You just say, yeah, a little bit GGO, ground glass opacity. And on day 15, you can see it just expanded to the both sides. And on day 20, and you can see the lesion field enlarged and become denser. And also we have some patients get recovered after treatment. This is the one patient I treated. She's 35 years old female, and this is day 11 and day 16 and day 22 and day 29. I was very happy for her improvements. Okay, so as for the diagnosis, this is based on the guideline from China. For suspected case, we will say whether the patient has the epidemiology history, for example, close contact with confirmed case, and travel history to epidemic area. And whether the patient has clinical symptoms like fever and respiratory symptoms, and also whether the patient's CT image showed typical viral pneumonia sign, and also we check the whole blood count. So if the white blood count decreased or lymphocyte count is normal or decreased. So if the patient meets one of the following criteria, we will think it's confirmed case. The first one is the RNA positive by real-time PCR, and this is the widely used in hospital, and the genomic sequence confirmed, but normally we don't use that. And then for the SARS coronavirus 2 antibody, if IgM and IgG positive, or IgG from negative to positive, or the IgG titers have 4-fold increase. Okay, and for the classification, there are 5 types of COVID-19, we think. The first one is asymptomatic type. The patients have the SARS-CoV-2 RNA positive, but it doesn't have any symptoms. So this is big concern for us right now. And the second type is the mild type. The patients have some clinical symptoms, but it's mild and with no any signs of viral pneumonia on chest CT image. And for the moderate type, I think majority of patients belongs to moderate type. The patients have fever and respiratory system symptoms and viral pneumonia on CT image. And for the severe type patients, if the patient's respiratory rate is over 30 beats per minute, or oxygen saturation less than 93% in the resting state, or the ratio of PaO2 versus FiO2 less than 300, or the chest CT showed a significant increase of lesion with 24 to 48 hours. So for severe type. Okay, for critically ill type, if the patients develop to respiratory failure or requires mechanical ventilation, or the patients have shock or multi-organ failure, or ICU care is needed. Okay, and then for predictor, for me, well, right now there's a lot of publications to show, okay, there's a predictor model, and you can calculate the score and to predict, okay, how severe the patient is. But for me, my experience is actually in the real clinical practice, you don't have time to do calculation. So I think timeline is very important. So this slide is adapted from the Lancet, the first paper of COVID-19. So I think this is a very good one. And it matches with the real situation. So normally the patients come to hospital on day 7, and on day 8 develop to dyspnea, and on day 9 develop to ARDS, and between the 10 to 11 days, the patients went to intensive care unit. So for any new patients, I always ask the patients, how many days after your symptoms onset? So if the patients fall into the second week, especially in the early time of second week, I will ask my resident, you need to watch these patients closely. Otherwise, the patients may be dangerous. Okay. And the second one, I think very important is age and comorbidities. So this paper published on JAMA by another hospital in Wuhan. You can see here, the average age in ICU patients is 66 years old, and non-ICU patients, yeah, is younger. And also you can see hypertension, yeah, about 58% have hypertension, and 25% of patients have cardiovascular disease, and 22% have diabetes. I'm also thinking about that, why the patients with these complications had high risk for mortality. I think this virus, it may enjoy the endothelial, the blood endothelial cells. So there's how to say, the coagulation system injured. So if the patient has this underlying disease, it's really easy to have organ dysfunction. Okay, and for the laboratory results, for me, I think I always watch the absolute count of lymphocytes. If the lymphocyte continue to drop and kept at lower level and cannot be back to normal level, so the prognosis will not be great. And also, we watch the neutrophil and lymphocyte ratio. So if it's higher than 3, and we have to be careful for patients. Also, we watch the CRP level and the demo and the chest CT image. If the chest CT image shows rapid progress, and the patient is in a dangerous situation. Okay, so we're talking about that, the symptoms and the diagnosis and classification and the predictors. How can we do in the real world situation? So I would like to show you that actually in general, in Wuhan, this is a real situation. We don't have enough medical staff to deal with this disease, and there are so many patients. But actually, among these patients, some of them are non-COVID-19, some of them are mild, and some of them are moderate, and some of them are potential severe patients, and some of them are real severe and critical ill patients. So what we can do, so first step we do is we need to exclude non-COVID-19 patients. How can we do that? So we ask all the patients with the fever clinical, they must finish the routine blood test and do the CRP. We do the chest CT scan. In the beginning, we do the chest X-ray, and then later on, we just give up. We just do chest CT scan. And we do the SARS-CoV-2 RNA detection and antibody detection. Of course, we do the flu RNA test to exclude the flu, and we do the respiratory related virus detection. And after doing this, we can figure out who is the non-COVID-19 in both of RNA and antibody negative, and who is COVID-19 patients. But here I mentioned that one group is confirmed case, another group we call the clinically diagnosis case. Especially in January and early February, we don't have enough kits, and as you know that the RNA detection could be false negative. But if the patients have very typical symptoms and very typical viral pneumonia features, yeah, we will treat the patients as confirmed one. Okay, and then for the confirmed case, what do we do? So we need to figure out who is mild case, and then we send the mild patients to mobile cabin if they're getting worse, and then we send them to isolation wards. So for the mild patients, this is the criteria we evaluate. Patients younger than 65 years old, and the patients can take care of themselves, and they are mental stable and without any severe underlying disease, no fever or low fever. And the oxygen saturation is over 95%, and neutrophil over lymphocyte ratio is less than 3, and absolute lymphocyte count is higher than 1200 per microliter, and CRP is normal or just mild elevated. Okay, and then for patients in isolation wards, yeah, we know that who is in moderate and who is severe critical ill, because we have criteria to evaluate the patients. But as an infectious disease specialist, I think it's very important thing is to identify the potential severe patients at the earliest time. So this is what we do. So normally for this group patients, their oxygen saturation is okay. Some of them even is 95, but if the patient with underlying disease, hypertension, cardiovascular disease, or diabetes, or age is over 65 years old, or still have fever, or there's not lobular lesion of lung, or the neutrophil to lymphocyte ratio is high, or CRP is significantly elevated, or D-dimer elevated, yeah, we will monitor these patients closely. This is very important. And then for the principal treatment of COVID-19, I just do a very brief introduction on it. So for the moderate type of COVID-19, yeah, we get antiviral treatment, and we give the antibiotic treatment if it's necessary. And of course, we deal with the underlying disease. And for the potential severe COVID-19 patients, yeah, we get respiratory support, and we get the immunomonitory treatment, supportive treatment, organ protection, and anticoagulation treatment. Here, I think I have to mention that the immunomodulatory treatment and the anticoagulation treatment are very, very important, especially for the patients who is on the early time of second week. This is the key point to manage the patients. And for the severe or critical ill patients, of course, we need to go do some respiratory support, CRT, or to the ICU. Okay. And how we discharge the patients. So if the patients doesn't have fever more than 3 days and the respiratory symptoms have improved significantly, and also the primary CT examination showed significant improvement, or the SARS-CoV-2 RNA test negative for twice, yeah, we can discharge the patients. Then after discharge from hospital, where the patients go, and here's the government's mandatory requirement. So the patients discharged from hospital, they have go to designated place for another 14 days. And then after discharge from the designated place, they need a self-isolation at home for another 14 days. So there are always some recommendations. So we encourage the patients, okay, stay in a single room and wear the mask and always wash their hands. And we encourage them to fever clinical for following up. And once they come, we will do the chest CT, antibody and RNA detection. Okay, I think it is very tough to deal with this disease, but everyone is a surgeon is better. Okay, so this is me, and this is my colleagues and I already just with the PPE, and we plan to go to isolation wards, and this is working in the isolation wards, and this is my team. Yeah, I have really great co-workers. Everybody work very, very hard, and we have very tough time. Well, but I think we will win. Okay, they're a couple, and both of them have the COVID-19, and husband's mom died from COVID-19. And when he come to isolation wards, his platelets just dropped to very low level and very severe, and he survived. So both of them smiled. I just covered eyes. And for this old lady, I just showed the chest CT. Her husband died from COVID-19, and when she come to the hospital, the oxygen saturation, I think, is only 90%. So this is me, and then I sent a card to her. I said, okay, your recovery is my greatest happiness. Okay, so this question is this nice picture. Let me think about Chicago. Okay, hey, Dr. Murphy, I just wrote down the question here. Do you think, should I answer the question?
I think, thank you, Dr. Zheng. Thank you very much for a great presentation. What we're going to do, we're a little bit short of time, so we have some other set of questions that I'm going to condense these a little bit, so we won't need those questions right now. So I know we're a little bit over, but I am going to ask the speakers a couple questions, starting with the question about the antibody tests. These are just coming online now in the United States, and could you explain a little bit how you use them? Do you have any data on the appearance of IgM or IgG antibody with your tests? Maybe Dr. Zheng?
Okay, let me see. Okay, for the antibody test, right now we use the kind of immunoassay and test both IgG and IgM, but we don't test the IgA. Actually, we have some data, but I didn't know that, so I didn't put here. And we found that actually, actually for severe people, their IgG somehow is higher than the moderate people, and also for the IgM, actually it starts to show up, but for some patients, actually the IgM can, both of IgM and IgG can positive for a long time. So right now we still watch, how long will this antibody exist. Yeah.
Great. Thank you. Maybe for Dr. Fan Wu, Chicago has an awful lot of cases. We're probably going to have more cases than China at some particular point. What do you think are the key public health lessons you would give advice for us now? Because we still, although we've had some improvement with the mortality and the hospitalization rates, we still have a lot of patients being diagnosed. We would appreciate your opinion. Thank you.
I think it doesn't matter what kind of stage that you are in this epidemic stage. I think the most important, this quickly identify the patient is important, because this is not only important to you, anybody else can do the contact tracing to further identify the close contact, and also do the quarantine for the close contact person. This is very important, because otherwise you spread the infection can spread in the community widely. And also important is, I noticed there was another question is about why you have a high fatality. I think this is early detection of these patients in early stage and give them treatments immediately. It's very important to lower the fatality. And this is also the second advantage for quickly identify the patients. The second, I think it is important, no matter what kind of stage right now we are, and we're taking social distancing and have the take the individual protection measures is also important, because even we are in epicenter, so people taking the face mask, washing hands, and also keep the social distancing with each other. It's also key issue as a non-therapy issue that we can take right now. So I think this is very important in any stage of the epidemic. For the further down, if we are in the early stage of the epidemic, I should say try to find out every patient, and to fully contact tracing is critical important. And if you already have the community transmission, and then the personal protection measures is the most important. Yeah. Thank you.
Right, no, thank you. Maybe you could follow up on that too. We're having a very significant problem in nursing homes, prisons, meat processing plants. I'm sure this must have been an issue in your country as well. How did you handle that any differently, or how did you handle that?
We have the outbreak in prison in early stage of the pandemic, but later on we don't have this outbreak in a certain community, and we don't have the outbreak that happened in Shanghai nursing home. The reason is we're taking very strict measures for these people, because all these people they don't have a lot of contact with the social contacts with outside of the nursing home, but all these viruses bring into the nursing home and is by the services or medical staffs. So we do the testing and try to identify the early infection of the nurses or medical staffs or services, the people who given services to the nursing home is important. So we also have a very strict measures for these people, for these service groups.
Thank you. Maybe for Dr. Zheng here. Have you much experience, or have you seen a lot of, or any cases that you think are truly a second COVID-19 infection, a second disease, independent from the first one? Dr. Zheng?
No. I have not seen, I have not seen any reinfection patients yet, but we do see some patients, the RNA detection turn negative and then turn positive, you know, but the patient's symptoms doesn't, you know, denote any symptoms. So we just think about that, okay, it's maybe associated with the detection.
Mm-hmm. Oh, that's really great to know. That question comes up here all the time. Another question for you, Dr. Zheng, that just came in from one of the people listening. What about, do you have any experience in seeing the rash on the feet and the toes that they're reporting here? Has that been a big physical sign that you see in your patients?
The rash? No.
Mm-hmm.
No, we didn't say that. Yeah, we didn't say that. The rash?
Yeah, we're seeing a lot of rash, particularly they're kind of like a dark blue, purplish color on the toes of the patients.
Oh, that's possible. Yeah, this is for the end stage of disease. Yeah, you will say that.
Okay.
Yeah.
All right. Maybe another question for you. What do you think now in China is the importance of the asymptomatic patients? Do you think, I saw some numbers actually with Dr. Wu, you showed some percentages of the asymptomatic, but how important do you think is the asymptomatic spread now?
Well, actually, I think our government deal with the asymptomatic patients seriously. So, like in our hospital, all the patients, with fever or with any respiratory symptoms, they have to come to my Phair clinical, and we will do the RNA test and antibody test and the CT image test, and to exclude the patient that have the coronavirus. So once we found that patients with the RNA positive, and the patients will be sent to the designated place for isolation for 14 days and then another 40 days.
Okay,
yeah.
Great. Maybe one last question for, for
okay,
Dr.
I would add some information for this.
Yes.
As asymptomatic patients, I don't think it's really a medical identification for a certain patient, because asymptomatic, it is a pre-symptomatic patient for patients, and someone is a hidden infection, right? So for as in Shanghai this time, as we tested for 80,000 imported at the porter. We do quarantine, and we only found 316 patients, they're positive person, and none is asymptomatic. So that means these persons are pre-symptomatic patients. So as until now, we don't know what kind of percentage will be. It is a hidden infection. So I think it will be different, the percentage, when places, when population experience different kind of model of pandemic. If in Wuhan, probably have certain hidden infection, and also have certain, currently, if you do the cross-sectional survey, we'll find some certain percent of the pre-asymptomatic patients. But I don't think there will be large percentage of hidden infection, as we found the data support right now.
Yeah, I totally agree with that. And actually, there's two types of asymptomatic. And the one type is the patients is just the pre-symptoms, so RNA positive, and then later on the patients have symptoms. And that type is the patients doesn't have any symptoms, and when we check the antibody, it's positive, but we never get RNA positive. Yeah.
I have one question more for each of you. Dr. Zheng, as long as we have you on the screen right now. Question just came up. Have you read this or heard of this term about kind of the happy hypoxia patients, the patients that don't appear to be hypoxic and their oxygenation is incredibly low? It's been reported incidentally here in the United States, but was written up in the UK. Have you seen this phenomena or know anything about it?
So the patients can tolerate the hyperoxygen.
Yes.
Yeah, we saw that. Yeah, we saw that.
Yeah, you
Yeah.
see it. Uh-huh.
Yeah, we saw that. Yeah, some patients, when they come to our hospital, is the oxygen saturation is only 70%.
Yeah, right.
The patients still, yeah, they're still okay. Yeah, we saw that.
It's amazing, yes. And
Yeah.
last question, because we're out of time. Dr. Pan Wu, we are all talking about, we haven't even got rid of the first wave, and we're already talking about the second wave of infection. What are the plans for addressing a second wave of COVID-19 disease?
Okay, so everybody talking about the second wave of COVID-19, and I think it's because right now we are really working, taking an eye on the trends. I think the second wave is depending what kind of type caused the second wave. As imported case caused the second wave, imported cases from the other country, or the imported cases or domestic case that due to the hidden infection, or you call the asymptomatic patients, that transmission. I don't think that right now the situation in Shanghai or in China, I don't think that a hidden infection or the pre-symptomatic patients will cause the large wave, second wave. The reason is we do quite early, now we do combined testing, not only PCR, but also testing for IgG, IgM, and the combined testing can find the early stage of the patient itself. And we also do very high quality contact tracing and stop the transmission. So probably that once again, we open the board and have a lot of flights with the connection with the other country, and then there will be a big challenge for us, because that means we cannot quarantine everyone for 14 days. That at that moment, and we need to thinking about what kind of measures that we can take. But still, I would mention what kind of the level of the epidemic in the other country is also concerned. So probably we still can't identify lower level risk area, or medium level or high level risk as a region, as the country, to do tailored for different measures for port quarantine.
Well, thank you very much. It's great comments. And I want to thank both our speakers tonight. This is going to wrap up our session. I want to thank Dr. Fan Wu and Dr. Xin Zheng for coming, and welcome back to Chicago, Dr. Zheng.
Yeah, thank you. I would like
I hope
it's my pleasure.
Enough. It was incredible presentations. We learned so much from your experience, and we really appreciate you taking the time out of your evening. I know this must be very difficult communicating with Americans being 12 hours apart, but we do appreciate your participation and your presentations, and thank you very much. And to everyone out there in the audience, thank you for your questions. The organizers, thank you for putting all of this together. And I hope you have a very good evening and a good morning here in Chicago.
Thank you. Okay. Bye-bye.
Thank you. Bye-bye.
Bye.
Bye-bye.